My name is Justin Danhof, and I represent the National Center for Public Policy Research. We're a free market think tank and a Pfizer shareholder. Happy to be here with you this morning. A few quick questions. The first one is, I have a New York Times article that says that pharma dedicated $150 million to an advertising campaign to support President Obama's healthcare overhaul. Do you know the final amount that was spent and how much of it was Pfizer money?
Well, the premise of that comment isn't exactly accurate. The PhRMA, the trade association, has for many years, actually predating the most recent legislative battle over health care reform, engaged in communications, both paid and unpaid, which means both advertising as well as grassroots communications, deploying employees and the rest, on behalf of principles that PhRMA and its member companies believe in with regard to health care reform. Those are in no way coordinated with anybody else. They represent our views as an industry on what we believe is right. And we have been consistent on those principles from beginning to end. And if you actually look at those communications, and again, some of them take the form of advertising, some of them don't, some of them actually are not consistent and have not been consistent with the positions that were taken in some cases by the government. Just to give you one example, when the House bill was passed on health care reform, we ran ads opposing it. We were running ads advocating greater intellectual property protection for biologics, even though the president actually took a different position. We were running ads supporting Medicare Part D as an important benefit for seniors, contrary to the position of some of the people in the administration. So we consistently advocated for views that we believed in. Now, it is true that we believed that health care reform, properly done, was something that we believe should happen. And there were many points along the way where we did advocate that an appropriate form of health care reform was something that should happen. But we were always consistent with our principles regarding what that should look like. We opposed the public option. We opposed price controls in our industry. And we were very consistent with our principles along the way. And I would say that by and large, again, back to my earlier comments, it's not perfect, but by and large, the bill that emerged was reasonably consistent with the principles we advocated. And in terms of the exact numbers, I don't have those available to me. But I can tell you that in general, PhRMA as a trade association and Pfizer as a company advocates both on a paid and unpaid basis for the principles that we believe in and that we think are in the best interest of our shareholders. Do you have another question?
Make me a very quick follow-up.
Sure.
Just briefly then, I understand that Pfizer and you supported the healthcare overhaul. However, the vast majority of the American public doesn't. So I was wondering, Rasmussen report after Rasmussen report, shows anywhere from 53 to 60% opposed. So I was wondering if there was a cost-benefit analysis of the reputational risk to the company done. And then I'm sure you've read some of Kim Strauss's stuff in the Wall Street Journal talking about the political backlash that may come with Republican staffers on the Hill now saying when the tides turn, Pfizer won't have a seat at the table anymore. So was there a reputational risk and a political risk cost-benefit analysis done in the decision to support the president's health care overhaul?
I did see that article. Look, the nature of being engaged in the political process is inherently one where you will get criticized, and frankly from both sides, and we were criticized from both sides. That's the nature of it. I do personally believe that in our business and in our industry, we have to be engaged in that process. Our business, by its nature, is very heavily impacted by what's done in Washington and state capitals and international capitals around the world. They have an enormous impact on our business and our company. And I just don't believe that we can either stand aside and let that happen to us, nor do I believe it's appropriate to be take a position that is opposed to everything that goes on. You have to be engaged and you have to try to be constructive, and sometimes that means that you will in an intensely partisan environment such as we're in today, that will necessarily create some adversaries. I will tell you that we worked very hard. I mentioned in response to Mrs. Davis that our PAC is I think, quite balanced. We work very hard with both sides of the aisle. I've spent a lot of time with members of Congress on both sides of the aisle. We're going forward very constructively. I believe that it is and was in Pfizer's best interest to engage in this process constructively, and now we move on to address other issues. And, time will tell. History will be the ultimate judge of all this, but I think that, as I indicated in response to the earlier question, when you consider some of what might have happened, given where this all started from, I think on balance, Pfizer shareholders are better off where we are today than where we might have been. But that's my point of view.